What's the #1 best test for diagnosing Lyme disease? If you've been struggling to get a real Lyme diagnosis or your tests just keep coming back negative, this video could save you months of frustration. In this video, I'm going to show you how the Lyme testing process actually works, the #1 best test that you need to take if you want to get a diagnosis, and the biggest mistakes that people are making with getting tested too early or too late in the process. But real quick, before we dive in, if you need answers right now, I created a free assessment tool that you can take right from your phone or your computer. No blood tests, no going to the doctor, no insurance programs. It's completely free. All you do is fill out a 25-question assessment. It's just 25 quick questions that tell you how likely it is that you've been exposed to Lyme disease bacteria. It'll give you a green, yellow, or red score instantly. This way you can get a sense of where you stand before spending a bunch of money on testing or going to see lots and lots of doctors. It's called freelymetest.com. Hey, my name is Ryan Kearns. I've battled Lyme disease myself, and I won the war against Lyme disease using all natural methods. Now I've worked with and helped thousands of people understand natural Lyme recovery so they can take back their body and feel like themselves again. When I first got infected with Lyme disease, I actually got lucky. I had the rash, that classic bullseye rash that you've probably seen on Google. I had multiple lesions all over my body, so as soon as the doctor saw me, they knew I had Lyme disease and I got an immediate diagnosis. But for most people, it's not that simple. Only about 20 to 30% of people ever have that classic rash, which means a vast majority of people don't get that immediate actionable diagnosis. And that's when things start to get confusing. And look, I completely understand why having that diagnosis means so much. It's not just about having a name for what you're going through. It's about finally getting validation for all the pain and struggle and this difficult process of healing from Lyme disease is. A diagnosis gives you direction. It opens doors to treatment options, makes sure you get covered by insurance, and sometimes it's the first moment you finally feel like someone is taking you seriously. Look, I get it. I've talked to hundreds of people who spent months, even years, being told it's all in their head, only to find out later that it was actually Lyme the whole time. And that's why one of the most common questions I get every single week is, what is the best test to get diagnosed with Lyme disease? That's exactly what I'm giving you today. First, we have to understand the core overarching problem, and the big core problem is that we're testing your immune system, not the bacteria. That's like testing for fingerprints of the bacteria, but not the bacteria itself. So if your immune system hasn't made enough fingerprints yet, then it simply will not show up on the test and you'll end up with a false negative, even if you've been exposed to the Lyme disease bacteria. So there's a traditional testing system that's recommended by the CDC that most doctors use and that insurance companies actually validate. That testing system is a 2-tier system. So here's how that typical Lyme disease test works. First, they give you an ELISA test. Screens for the antibodies that your immune system creates to specifically Borrelia burgdorferi, or the Lyme disease bacteria. If this test is negative, usually the doctor just stops there and that's that. But here's the problem. It can take 2 to 6 weeks for the body to even create antibodies against Borrelia burgdorferi. So that means if you test before 2 weeks, it could be negative. And if you test after 6 weeks, it could be negative. That's a very small window that you have to hit in order to get a positive ELISA test. And then if the ELISA test is positive, or if it's borderline, they move on to what's called the Western Blot test. The Western Blot test looks for specific bands, which are really just immune system reactions. In order to be considered CDC positive, you need a certain number of these bands to light up in the testing process. Some of those bands are actually Lyme disease specific, but the CDC actually excludes several different bands from the test. So patients can be positive by symptoms, yet still fail the strict definition of Lyme disease based on this 2-tier system. So even if your body is fighting Lyme disease, if you don't meet a very specific criteria of antibodies that your immune system is creating, you could come up with a negative test and walk out with no answers. I've seen this happen over and over again. People get stuck in that testing cycle, never really knowing what they're dealing with. This all has to do with the timing trap of these tests. So first, on day 0, you get a tick bite, bacteria enters your bloodstream. On day 7 to 14, the immune system might still be quiet. You may not have created any antibodies towards Borrelia burgdorferi yet. Then on day 21 to 42, this is when antibodies are finally appearing in detectable amounts, and you will probably get a positive Lyme test if those antibodies are created day 21 to 42. Then day 60 and beyond, chronic cases usually have low or inconsistent antibodies, which makes it very difficult to test and get a positive test for Lyme disease in chronic cases. If you got bit by a tick more than 60 days ago, it's hit or miss whether you'll get a positive Lyme disease test. A lot of times people don't even realize when they've been bitten by a tick, or they don't even realize that they have this bacteria in their body until they start getting symptoms, but it's been longer than 60 days since you've had the bacteria. So altogether, that means if you test too early, you'll likely test negative. If you test too late, you might still test too negative, because your immune system isn't making those antibody markers anymore. Imagine trying to photograph a lightning strike. If you're off by a second, you'll miss it. And again, unfortunately, this is the testing system that's recognized by the CDC, by insurance companies, and by doctors all over the world. Most experts say that it's about a 50% chance whether or not you get a false negative. That means you can basically just flip a coin to see if you have Lyme disease. And that's not good. That's why more often than not, the advanced tests are what we want to lean more towards. They're so much better. They can detect multiple different strains and species of Borrelia, which now we know there's over 20 or 30 different species of Borrelia bacteria. It's not just Borrelia burgdorferi. Not only that, but there's a host of co-infections. Think about it this way. When you get bitten by a tick, a cocktail of bacteria can enter the bloodstream, and it's got all different types of bacteria your body needs to deal with. Now, if you cannot detect that bacterial load, you'll never know quite what you're dealing with, and you'll be in the endless process of testing and trying to figure it out forever. That's why advanced tests are so important. I personally always recommend the company IGeneX. They have very deep lab testing that can be very, very crucial for understanding the overall picture of the microbial load that you're dealing with. This lab measures both IgG and IgM with greater sensitivity. If you don't know what that means, it just means that they have a more accurate picture of what's going on inside your body. Sometimes they even look for T cell or DNA markers in addition to antibodies, which is just something that the other tests can't do. You can think of this like upgrading from a metal detector to a more modern one. You're simply going to get more results more of the time and more data and information to make decisions off of for your health. The only problem with these tests is that they tend to be sort of expensive. Oftentimes it can run $600+ just to get the testing. And unfortunately, a lot of times insurance doesn't cover it. In the end, we're left with systemic confusion, and patients are often left in limbo. First of all, most doctors only run the CDC recommended tests, which are the least sensitive. And as I said, it's 50-50 whether or not it even works. Secondly, insurance companies only reimburse those standard tests, which makes it so that most clinics don't offer any better testing options. It's really not the fault of these doctors. They're using the tools that they've been taught. And so when the test comes back negative and the patient still has a bunch of symptoms, the doctor has nothing left to say other than, it's all in your head, or you're not sick, you're fine, which is just terrible. And you see people go through this dark period of their life. They start to spiral when their doctor's telling them they're fine, but then they're feeling symptoms every single day. Who can they trust? Where can they go from there? So at that point, they either keep suffering or they start researching, which 9 times out of 10 leads people right here where we are today. I have people from all around the world reaching out to me every single week for help with their symptoms, with Lyme disease, with diagnosis, with natural healing, with trying to get better from Lyme disease, so they can take back their body and start to feel like themselves again and show up in their life the way that they meant to all along. Nobody asks for Lyme disease, but it's really valuable to understand what you're dealing with so you can move in the correct direction and start to get better. Too many patients end up in this weird gap. Their body knows they're sick, their symptoms show them that they're sick, but their lab paperwork says they're fine. This is where so many Lyme warriors get stuck. But maybe the best part about using a holistic, natural framework in order to get better is that you don't need a diagnosis to start taking action. While I understand completely why you want one, even if you get stuck without one, we can start doing simple things to support your body, support detox pathways, build a healthy immune system, and so much more. That's exactly what I'm here to help you. I got 3 free things for you to get started on your Lyme disease journey that are going to help you out. First of all, if you don't have a Lyme disease diagnosis and you just think you have Lyme disease, you should go to freelymetest.com. Secondly, the Lyme Survival Guide. Now, I've been through Lyme disease. It affected me deeply. It was very difficult for me. I was able to come back in an all-natural way without using antibiotics or doctor's offices or really expensive treatments. I used herbs and diet and holistic wellness to get better. And I detailed everything I did in a 6-step manual that you can get for free. The link is below this video. It's called the Lyme Survival Guide. All you have to do is put in your email address. We'll send it over to you. You'll have it for life. You download it and it's yours. This is our gift to you for checking out our stuff and for being involved in what we're doing. And to date, we've given away over $400 to Lyme disease organizations to help with the funding, the advocation, and research of Lyme disease so we can help more people get better, take back their bodies, and feel like themselves again. If you want to be involved with things like that, I suggest joining our free community where we talk to each other, we help each other, and we show each other the path of getting better in an all-natural way. The link for that is also in the description. So go to the description below this video if you want any of those free tools to get started down your Lyme disease healing journey. I'm here for you. If you need anything, comment below, ask any questions that you have. Just go down below and let's get started working together. We've got a bunch of free stuff for you to get started, and I can't wait to see you in the next video. Thanks so much. Bye-bye.